To protect Social Security and Medicare, we need members of Congress who understand how important they are. We at the National Committee are nonpartisan. Our top priority simply is to support candidates who stand with us on these critical issues. With your support and with your votes, Ron Barber will be one of these members. Depart from my script once more. Ron, come on up here. To prepare you for Washington.
That's unexpected right there. But it is a fight. And we're going to do it in a way that we know how it's best to do it, that is to stick to the issues and not to make things up. So I really want to thank you all for coming today. I'm overwhelmed by your presence in such great numbers. It's awesome to have you all here, and thank you for that. And thank you, Frank. Thank you for your wonderful introduction. Frank, come on up here. I want to have you stand beside me as we make these remarks. And when you told your story, which I've heard before, as you know, it was reminding me of the many stories that I've heard as I went across this district, serving as Congressman Gibbons District Director, and more recently, as I've started this campaign, and talked to Americans, Southern Arizonans, all across this district, from Douglas, Bisbee, Wilcox, Green Valley, Marana, Oro Valley, and Tucson, and more to come. And what I've heard from all of those people that I talked to is one thing in particular, and that is that they believe and they feel strongly that the country is facing a very serious problem in that the middle class is disappearing from sight, with wage stagnation, job loss, underemployment when you do go back to work, and foreclosures at one of the highest levels in the country. These are the stories that I've heard over and over again about how crucial Medicare and Social Security is to literally thousands of seniors and their families. And a big part of why I'm running for office is to make sure that seniors can stay a part of the middle class, especially those that rely for so much on Social Security and Medicare, as was said by Phil. Unfortunately, my opponent has a very different view. Jesse Kelly's agenda was put the rich first and leave middle class and families and seniors last. We will not let that happen. When it comes to benefits that seniors have spent a lifetime to earn by their investment, every paycheck, Jesse Kelly has said, on the other hand, that Medicare should be eliminated and Social Security should be phased out. He has said that seniors on the Medicare are on the public dole. He has called these programs, I didn't know you were the person on the dole, I have to say. But these are payments that people have made. This is not welfare. This is what people have done to invest in their retirement years. These incomes and this medical care is essential to having a reasonable and decent retirement. And I have pledged from the very beginning, and I have worked for the last 5.5 years as district director to help seniors hold on to their Medicare and Social Security benefits, fighting government agencies when they weren't responding in a timely manner. And I'm absolutely committed to reducing the deficit the right way. That's not to privatize or Social Security or Medicare. And specifically, I've made 4 promises regarding Medicare that I believe are being more and more heard by the people of this district. First, I will not support massive cuts in Medicare benefits. I will not support support making Medicare a voluntary program. Simple logic tells us that in a voluntary program, if healthy seniors walk away, it will make Medicare much more expensive for those who need it the most. I will not support making Medicare a voluntary program. Neither will I support a Medicare program that requires seniors to buy private insurance. You know, the plans that have been proposed and passed in the most recent House bill would really be ruinous to this program that so many seniors depend on, and Frank and others know very well has helped save their lives. And fourth, I will not force seniors to bear the burden of fixing the deficit. Seniors have worked hard all of their lives to earn Medicare benefits, and we must keep up our end of the deal. And similarly, we absolutely cannot allow Social Security to be privatized. The nation has watched the volatility of Wall Street. In fact, I was with 500 seniors, and Dr. Annie Weil was conducting a seminar over at the YWCA when the stock market tanked and $1 trillion of investments were lost that day. Can you imagine what it would have done to seniors if Social Security had been in the stock market? It would have been ruinous to them, and we cannot let this happen going forward. We cannot, and I will not, gamble the hard-earned dollars of Arizona seniors on the stock market. I really wish I could stand here today and tell you that there are no politicians in the United States, or at least in Arizona, that believe we should eliminate or privatize these programs. This should not, and in the past has not, been a partisan issue. We should all agree that every person standing behind me and in front of me that deserves the benefits they paid into over their lifetime. Unfortunately, it's simply not the case that we have no politicians willing to basically destroy Social Security and Medicare. I'll just say this. My opponent is experiencing an extreme makeover. And what I've said from the very beginning is what I'm saying to you today. No change, no wavering, no flip-flopping, no extreme makeover. I will go to Congress if you'll help me to be a strong voice in Congress, and I pledge to you today, as I have every day since this campaign started, to protect and preserve Social Security and Medicare. Thank you all so much for being here today. And my wife will tell you that. This is my wife, Nancy Barber. We'll be celebrating our 45th anniversary, hopefully in Washington, D.C. on the day I was sworn in, as you remember. Questions from any of the press? Well, let's go to the press first, and then we'll go over to others. Anyone? Yes, Andrea.
Tom, you say you want to protect Social Security and Medicare and keep them for people who are receiving the benefits. What about the insolvency, the prospective reduction in benefits coming up?
Well, first of all, I think it's important to note that the most recent report from the trustees of Social Security have indicated that it's solvent through 2033. That's a ways off, but not so far off that we don't need to be thinking about ways in which to extend the solvency. You know, one of the things that most people don't know is that Social Security has a $2.5 trillion surplus going forward. So that's part of the solvency answer. And secondly, as we go forward, I think we need to make the kinds of adjustments that we've made in the past that have been bipartisan. And this is the problem that I think we have today, with ideological extreme views coming into play, not allowing us to get down to the serious business of making sure that we take the steps we've taken in the past to extend solvency. But solvency is at least there for another 20 years or so. And you know, one of the other answers to the question of solvency is getting Americans back to work. The more people that are working, the more people that are working, the more they're paying into the system for themselves and future and other generations to make have those benefits. And one of my absolute commitments to this community is I'm going to do everything I can to get Americans in Southern Arizona back to work. Other questions? Jim.
Ron, could you comment on the proposed changes and reforms of Medicare Advantage?
Well, there are some changes that are in the Affordable Health Care Act. And what they really do is, over the course of several years, reduce the overpayment, basically, that's been going into those programs from the Medicare programs. And that's not a cut in service. That's an overpayment that's going to be corrected over time. And secondly, the changes that are in that same bill would really crack down on fraud and abuse. Medicare, unfortunately, is one of those federal programs that is the most susceptible right now to fraud and abuse. We just saw a couple of days ago huge arrests in Florida, which unfortunately is one of the highest Medicare fraud states in the country, because obviously so many seniors live there. But over in the last month or so, something like $500 million in fraud has been investigated, and people are being prosecuted, and we'll be restoring that money to the system as those prosecutions go forward. More serious, including those kinds of actions, more serious action to reduce fraud and abuse was certainly part of the plan. And then the other thing that's important to point out is that under those changes that we talked about in Medicare, preventative care is now available to seniors without a copay, so that they can go in and get the kind of preventative services that they need to stay healthy longer. These are changes that are positive. They're not cuts, as some people would suggest. They're adjustments to bend the curve over time of the cost of Medicare, and they make sense. Yes, Anthony.
The issue with Social Security solvency overall might be decades out, but the issue with the Disability Trust Fund is much more immediate. That's going to be bankrupt within a couple of years. Yeah. What should be done about that?
Well, I think it has to be taken seriously. I mean, when I worked for 32 years with people with developmental disabilities, I know how important those SSDI payments are to them in terms of living in the community. It pays the rent and utility bills. Without it, they would not be able to live semi-independent or independent living. So I have to tackle it, and I hope that we will have the good sense in Congress to find bipartisan solutions. What we have today is this great divide. Those who would want to destroy Medicare and Social Security as we know it, but no willingness to compromise and come to the middle. So that's what I'm going to go to Congress to do. All my adult life, I've tried to find middle ground and to be a problem solver. That's what I did in developmental disabilities. That's what I did as Congressman Gifford's district director, and that's what I will do as a member of Congress. And I believe that there are Republicans and Democrats who are willing to come together to take urgent action to make sure that program is extended. I think when we go there, and I work with others, as I know Congressman Gifford did in the past, we will find solutions. It is a much more urgent matter, as you pointed out. We can't wait too long. We have to solve it within the next 6 months to a year. Other questions before we go? Are you guys all taken care of? Okay, sir.
As you know, the deficit's a huge problem, and who do you think should pay it? The current middle class will pay a good part of it. And should it be the current middle class, or are we going to pass it on to our children?
Well, not to our children and not to our grandchildren either. I've got 4 beautiful grandchildren who live here, and I've got a personal as well as a, hopefully as a member of Congress, an interest in making sure that we balance the budget and deal with the deficit. We have to remember where it came from and not have a short memory that it all of a sudden appeared in the last 3 years. We have to build our way out of it by getting people back to work. We have to make informed and smart choices about reductions, and we have to have revenues coming in to make sure that we can increase the ability to pay for vital services. But this is going to require bipartisan solutions. And I think the president has tried with Speaker Boehner to come up with a plan that would resolve some of these issues, the big issues. Unfortunately, Speaker Boehner was not able to sell it to a small minority of his caucus, and it went down. But there is goodwill, and there are plans, and there are ideas that will help us resolve the very problem we talked about, but it has to be done in a bipartisan way. And I think I have the ability to cross party lines to make sure that that happens. And I hope I can have a chance to do that come late June this year.
How many years do you think it'll take?
I don't know how many years it'll take. It took us a fair amount of time to get into it. It's going to not be
No, I mean,
solved.
your plan to pay off the deficit.
Okay, I'm just going to take a couple more questions and then we.
Yeah.
My one issue is healthcare, universal healthcare. And the reason why I bring this up, I have been a diabetic for 70 years. In my early 40s, I came down with something called diabetes retinopathy. Fortunately for me, I had health insurance. I was able to get the argon laser treatment, and it saved almost 20% of my sight. I was able to continue to work for another 18 years, head of finance, and they had a blind accountant, which they did not know. Had I not had health insurance, I would have been totally blind. And then what would I have done? But it was health insurance. And Otto von Bismarck, who's the Chancellor of Germany that started universal health care, said, a healthy nation is a productive nation.
The AC back on. If we have people are welcome to stick around and chat. I just see a bunch of people.
One question from the lady right here with the blue.
I just want to know, are you planning to have a debate here, Jesse Kelly?
Those discussions are underway with Mr. Kelly's campaign, and yes, we are planning to have one, possibly two.
Good, because, you know, the line is coming out.
Yeah, we'll have those opportunities.
We need it.
Jess, how do you
Yeah, I was just gonna say, if everyone wants to come up and chat, I know some of the people in the back look a little warm. We'll turn on the air conditioning and stay around for a little while.
Thank you very much for being here this morning. I really appreciate it.